Revolutionizing the way people treat people in business. The Experience Pros, America's home for positive business talk.
Welcome back to the Experience Pros Radio Show. This is America's home for positive business talk. Where do you go when you got a tickle in your throat and I can't help but cough over the national radio airwaves? You go to Snyder Insurance and say, I need medical insurance. Right,
I can't help you
right
on that one.
No. Gail Snyder sitting in for Angel. Thank you so much.
What a pleasure to be here. This is so much fun.
Love having you, and your invitation to return is already written and in the mail. You're doing a fantastic job here on the program. Gail, let's talk about the state of health insurance.
Okay, our counselor just left. Can we bring him back,
right?
please? Oh, it's messy. It is
Why?
so messy.
It was supposed to be affordable and easy.
Well, in the title, it's the Affordable Care Act.
Right.
Act.
Act.
Not reality.
Oh.
Yeah.
That's the first time I've heard that.
Yeah,
that's good. That's all right.
Yeah. So kind of an interesting thing that happened this past open enrollment. Open enrollment now means you have to buy insurance during the window that is open enrollment for a January 1st effective date.
Okay.
And if you miss that, you can't buy insurance until the next open enrollment.
And that open enrollment starts?
Well, they move it around a little bit, but primarily it's November 1st through December 15th.
Oh, okay.
And then your policy starts January 1st.
Right.
So they've moved it around a little bit to accommodate system outages and things like that. When things don't go as planned, they give you a little extra time.
What could go wrong? Okay. A website?
Well, yeah. And all of a sudden, the last day, the number of people that, this is your favorite topic. So clearly you're going to want to do it right away.
Right.
But if you happen to wait till the last minute, then system might crash and then they give you a little bit extra time.
Is it true that insurance providers are dropping like flies?
Insurance carriers, the companies?
Yes.
Yeah, they really have. When I first started selling health insurance almost 20 years ago, there was a lot of choice.
Right.
And I won't say that they were inexpensive, but I can say the cost is nothing like it is today.
No, it has skyrocketed. And I want to put a business perspective on this. We Experience Pros gain our medical and health insurance through your services, and
we are very honored to do that.
Hooked us up with some a provider, but even in the last year, that has shifted
significantly.
Yeah.
So here's the part of that you haven't seen because you have an employer that provides it.
Right.
On the open market, if you are a family buying insurance for yourself and your kids, your premium last year from a month to month premium basis went up between 40 and 48%.
Did you say 40 to 48%?
Yes.
And so Gail, I'm not the brightest bulb in the knife drawer here.
That's a lot.
But let's just do a little math here. If I'm paying $100 and nobody is, just saying,
it would go to 150. Ours went for my husband and I and our two kids that are in their early 20s.
Yeah.
Ours went from $1,200 to almost $1,900.
Yeah, the average family can't afford
that. What was really interesting is the small group market, the employer market.
Yes.
Went up only about 3 to 5%.
Wow.
And so instead of buying it on our own, we this year offered it through our business and we're able to bring our premium back down to almost what it was last year.
Okay.
But then there's some rules with that. You have to have one W-2 employee that signs on that's not the owner or the owner's spouse.
Okay.
And so you have to have a legitimate group of employees to offer it to.
Yes.
And your employees have to earn enough. They're not already getting Medicaid or the tax credit because if they're getting those, that then is off the table and you've just messed their stuff up. You can't compete with what the federal government's getting. So it's very complicated.
It is complicated. And it seems like, and this is no reflection of you. I mean, you are the navigator. You help us get through these things that nobody really has the time or energy or interest in getting through. You take the time, you put in the energy, you have the interest so that you can guide our journey through all of this. But it seems like from the provider's point of view, there's a bit of a shell game going on with, okay, well, if you want to have your premiums lower, we just adjust your deductibles. And deductibles are outrageous.
Well, and the hard part is in order to keep the premiums as low as they are.
There's air quotes going somewhere.
Yeah. In order to keep the premiums as low as they can, they increase the deductibles.
Right.
And then because now your maximum out of pocket, it can't be any higher than the $7,350 per person.
Right.
That's the maximum allowable by law.
Okay.
But they also have to include things that before Obamacare, the Affordable Care Act, before that, mental health wasn't covered.
Okay.
Now that's covered like any other illness. So I'm sure that Mr. Johnson or Dr. Johnson is seeing that.
Right.
And it makes a big difference. That's covered. There's a lot of other coverages. Pre-existing conditions have to be covered. On the individual market, the policies that we're buying for ourselves and our families, not through our employer, those policies have a lifespan of 7 months. People buy it and they drop it. They buy it for a January effective date, get their surgery, and drop it by July.
Nobody's using that. Are they gaming the system?
Oh, of course they are. At this price, quite honestly, when the cost is that high, I can't say I blame them.
Yeah.
But they're not just gaming the system. Those policies are what people buy when they leave or lose their job and they need something for 3 months till the next one kicks in. And so they're not really looking at those as part of the problem, but it's a legitimate part of the problem. There's a lot of administration that goes into creating those.
Folks, if this is as clear as mud to you, may I suggest that you get to know Gail Snyder and Gail, give some contact information, if you will, please, because
I kind of want to give your phone number on this one, Eric.
It's a speed dial to you.
No, I love to help people. Our number is 970-461-5060. And our website is lovelandinsurance.com.
The phone number one more time.
970-461-5060.
Don't be put off by lovelandinsurance.com. They care for anybody who will reach out to them and say, hey, I need some help here. Just trying to understand the thing. And that's the thing that I love so much about you, Gail, is that you make the conversation palatable for the average Joe. I don't know anything about what you know, but I know that I wouldn't dare go into an insurance conversation, especially for our business, without knowing you.
Thank you.
So that phone number one more time.
970-461-5060.
All right, folks, we're going to ask you to stick with us. Top of the hour news is next, and then hour number 2 of the Experience Pros Radio Network.
America's home for positive business